All right, welcome everybody. This is the CalPIC Private Practice Checklist for Beginners. My name is Corinne Eisenhart. I have been in private practice for 5 or 6 years. I'm also a CalPIC board member, and I am the committee head to the Ethics and Applied Professional Practice Committee that has kind of the private practice section that I focus on. And today I have with me Zack Reed-Fier. You can introduce yourself a little.
Good afternoon, everyone. My name is Zack Reed-Fier. I'm currently a private practitioner, both in my own private practice as well as a group practice. And I'm also pretty involved in CalPIC. I'm co-chair of the Disaster Mental Health Committee, as well as formerly the Los Angeles Regional Networking Coordinator. So glad to be here and part of the private practice committee.
Yeah. All right, moving on. How do I get to the next screen? Oops, sorry about that. All right. So first off, I just wanted to start by saying who is this presentation for? Because as you saw, for beginners, this is probably going to be a little bit too beginner for someone that is already in practice. But this might be for someone that is looking to get to know what it takes to set up a private practice to see if it's right for them. Someone who would maybe like to start up a private practice and wants to kind of know the steps, and someone who started a practice recently and might want to just go through to see if there's missing any steps for the private practice checklist. And just to FYI, we are going to have the checklist available. Our tech team is uploading it as we speak on the presentation hub. So you can follow along if you want to, or later you can download the actual checklist. It's going to be on the CalPIC website as well. And so anything else to add about kind of who this presentation is for, Zack?
I would say even if you've started a private practice, if you're in, maybe the first few months, first 6 months to a year, you still might benefit from this checklist as just kind of a review and something to kind of make sure that you keep yourself on track. It's by no means a be-all, end-all list. This is something that we're constantly adding to. So I think it's important to just note this is for beginners and maybe individuals who have just started their private practice as well.
Yeah. Yeah, along that same line, we do have some disclaimers that this is not the full adapted list. There might be different things that you will need for your location, your area, expertise, all of that. And we will try to keep this checklist updated throughout the years. We also will, throughout the webinar, recommend consulting with your own attorney and CPA, because every practice is a little bit different. Every location is different. Just with CPAs, we don't know your, tax bracket and your deductions and all that. So we can say kind of rough estimates, but talking to the professionals would be helpful. We have a lot to cover today, and we may or may not be able to take questions at the end. We're going to do our best. If you do have any questions, please submit them to info@calpic.org, and they'll be sent to me and I can answer them for you. Also, just today, if you have any tech issues with the presentation or anything along the way in this conference, feel free to email events@calpic.org. Anything else, Zack?
I think that covers it.
Cool. All right, so jump right into the business basics. The first thing that I highlighted is just double checking if private practice is right for you, because it isn't right for everybody. And I think people should know that it does include a lot of things that might make people nervous about getting involved in a private practice and going off on their own. And so some questions that you might want to ask yourself: would it be better to say, go to a group setting or community setting where you can get more support and kind of collaborative effort? You might have a clinical supervisor that can help you out along the way. Private practices can be very isolating. And so me, myself, as a sole practitioner in my private practice, I've purchased my own hours of supervision, clinical supervision when I needed extra support, and run the peer consultation group with CALPCC just because it's so helpful to get assistance through other clinicians, but that might be something that is easier for you to do in a group setting. Do you want to do the business side of private practice? There's a lot to do after you are just meeting with clients. You need to figure out how to market yourself. You need to do all the back end of accounting and figuring out business law. And, it doesn't just stop at you meeting with your clients. And so there's a lot of establishing the business and ongoing, fixing up your marketing to make sure that you're bringing in the clients that you need. Do you want all the liability? So when you're in a group practice or a community setting, if you are sued, that community group is going to help you along the way and be with you as you are going to be taking on a lawyer or whatever that takes to, work through that liability. In your private practice, you are alone and you're doing all that all yourself. And I do want to say that even if you're the best ethical counselor out there, you still can be sued anytime. It is just part of the job. Do you want fluctuating income? This is a big one. And I think on, the chat, it's on Facebook groups. Everybody's it gets a little nervous when, say around the holidays when their income goes down. And this is just something that you have to deal with as a private practitioner, is just dealing with that fluctuating income. And would you rather have a reliable paycheck coming through? Okay, and then the last, would it be okay not to have the benefits of, say, working at a W-2 practice, benefits like health insurance, or maybe they match retirement? These are all things to think about. Anything else to add, Zach?
I would just add around the business side of being in private practice. When you go into private practice, again, if it's a sole proprietorship or a group practice, a group center, I think it's important to know, there is a certain entrepreneurial mindset related to it. So, for some people, that aspect might be kind of daunting. Just want you to know there's been thousands of individuals who have gone in private practice who are just as uncomfortable with kind of the risks involved in private practice and have been able to develop a thriving private practice. So it can happen. You can have a thriving practice, and this continuing on this checklist will help.
Yeah. Yeah, I think it's also important, like, you don't have to do it right away too if you're a little bit nervous. Maybe
Exactly.
waiting a little bit longer. I think people are getting into it earlier than, say, they used to, but you can do a lot of these steps later on too.
I think that's a great point. Just in general, having everything prepared ahead of time. There's a lot of moving parts in a private practice. So, you'll be developing it as you're in your first year, maybe second, maybe 3 years. You're constantly building to it. So it's not going to be perfect all from the beginning.
Mm-hmm.
Well, I think, moving from there, it's important to be licensed in your state. So if you're in the state of California, you got to make sure that you're licensed appropriately. If you're an associate that's interested in getting involved in a private practice, you have to be supervised by a licensed clinician in the private practice space. You cannot go into a private practice and develop your own business by yourself as an associate. So it's really important to recognize, like, if you are looking to go into the private practice space, if you're an associate, you have a supervisor that you're working under. And if you're moving into licensure, making sure that you cross the T's, dot the I's when it comes to your licensure. Also, what's important is getting a national provider identification number, or an MPI. Depending on where your background is, you may or may not already have a number due to being involved in treatment centers or community mental health agencies or hospital settings. This is a pretty popular number that is utilized by a lot of healthcare entities, including insurance, as well as medical settings. And then when you're in private practice, this is your unique number to help identify who you are. You can do that by going to nppes.cms.hhs.gov. So again, if you do a Google search and just type in NPPES, that'll be the space that you can apply for your MPI.
It will be on the checklist too.
Totally. Next piece is picking a name. This could be your name itself, or it could be another name that you want to brand your practice as. Something particularly of note, you want to pay close attention to what the Board of Behavioral Sciences requires and allows for licensed professional clinical counselors to advertise themselves as. So particularly in the private practice setting, you want to make sure that you're following those ethics and guidelines, particularly if you decide to not use your name and you decide to apply for a DBA, or something also known as doing business as. If you're not going to use your name, you got to make sure that you're following the right rules when it comes to the advertising. From there, determining your business structure is key. This can include a sole proprietorship if you're a single therapist in practice, an S Corp, or a limited liability corporation. It's important to note, in a lot of other states, a lot of mental health practitioners use the LLC format. However, in California, LPCCs cannot register as an LLC. You're either a sole proprietor or an S Corp. Following that, you got to identify yourself with the federal government. So that means registering to get a tax ID number or an employee identifier number. This is ultimately for you to kind of differentiate between yourself and your business entity, so that you're not always using your social security number.
Yeah, you can use your social security number, but I think nowadays with everybody's information being stolen, I think that it's safer to go the EIN number route.
Totally.
Yeah.
Totally. Anything else you want to add, Corinne?
Yeah, I just, going back to what I said in the last slide, this can change too. Currently, I'm using my name as my practice, and so I don't need to file a DBA, doing business as. I am also a sole proprietor at this point, but there might be a time when I open a group practice or want to work under a group practice name. Also with the S Corp, I know a lot of people are looking into that. Talking to an accountant to see if it would be beneficial for you. And when I talked to my accountant, he said that there is kind of a threshold of, if you're making over this amount of money, then it's probably a good idea to start using an S Corp. That whole structure can take a lot more work, going through a lawyer to get that established. And then it kind of does require you to do an accountant every year if you want to figure out to do the taxes yourself. Is really confusing. So, yeah.
Awesome. Well, moving along, the next piece is you got to make sure you have malpractice insurance. For some individuals, this might be something that you've had since you first started doing counseling or therapy work in the field. For others, this might be a new concept. So it's important to make sure that you sign up for malpractice insurance. Most policies are at a minimum of $1 million coverage, and sometimes can go up to $3 million. And I think even recently I saw a policy that goes up to $5 million. Just kind of depends on your structure and your type of practice. One that is often kind of advertised and has been connected with CalPIC in the past is HSPO, which is one malpractice insurance company, and there's many others that are pretty popular for LPCCs. The next piece is to apply for a business license. This can really vary from your location in California. So if you're in the city of Los Angeles, like myself and Corinne, you would have to register with the city of Los Angeles. But if you're in unincorporated areas, you would file differently. If you're in a township, you would file with your local business association and part of that government. Make sure to double check what the requirements are for a business in your area, because they vary greatly across the state. Once you do that, you definitely want to register your business with the state of California or your state government if you're registered and you're practicing in multiple states and hold multiple licenses. You want to make sure that you're registered in each state. For some people, it's really important to create a document called a business plan. And this is, again, something that could be a guide for you in your first few months of practice, first year, 2 years, 5 years. This is something that can just be kind of a guidepost to help you along the way in creating a plan for your practice. This could be from the number of clients you want to see, your payment structure, marketing, expenses. It's a plan that can be really helpful to kind of give you the big picture of what's going on in your practice. Along with that is deciding on what type of practice you want to have, whether you want to have an individual practice, be involved and create a group practice, maybe a counseling center. And again, similar to what Corinne mentioned earlier, this can change. You might start off with an individual practice and want to later change and create a group practice. These things don't have to always stay the same. They can change over the course of time. Any other thoughts, Corinne?
Yeah, the only other thing is kind of with the malpractice insurance, everything, I've renewed a couple times recently, and they're always offering different things that you can add on to your practice, like cybersecurity or whether or not you want licensed security, if you have something come up with the BBS. Also, something that I looked for when I was looking for a malpractice insurance is whether or not they provide free consultation with lawyers, which has come up for me already. The one I'm using allows you to have up to, I think, an hour to 2 hours consultation with a lawyer. If you call in, they'll refer you to someone just to check to make sure that you're doing all the right steps to avoid any kind of liability. So, okay. All right, continuing on with the business basics. There's so much basics. Yeah, so setting up clear policies. So this is your practice. This is your business. So you get to decide, do you have appointment cancellation policies? When are you going to be available? What are your hours? How much are you going to charge? And so it's figuring out all of that on what works for you. And that can change as well with your life and with as things come up. But it's good to have that all documented in the paperwork that we're going to talk about later on, so that the clients know kind of where your boundaries are at, and whether or not you're going to be charging for cancellations within 24 or 48 hours. So along that line, creating paperwork. There's a lot of paperwork to a private practice, including intake forms. And this, we could have an intake form for, say, just individual work, for working with a minor, for working with couples, working with family. And I do want to note that as part of our committee, we are trying to put together some sample documents for our membership that will be available soon on the website. And it will include hopefully a lot of these forms, these basic forms anyways, because there's a lot that you need to cover, and California itself requires a lot to be included in, say, your notice of privacy or your informed consent. You also need kind of a release of information, financial agreement or authorization, say how much are you going to charge them, signing off on that, how is it going to be charged, to a discharge summary, also other things like progress notes, session notes. If you are going to provide super bills for clients to get out of network reimbursement. If you're going to take insurance, having a form for them to fill out with their insurance information, so you can bill the insurance. If you're going to provide telehealth, either through video or phone, having a TAC agreement, so a technology assisted consent form for all the risks that come along with being on something like a phone. This is really relevant right now as consent form, and I'm updating mine to go back in the office soon. COVID consent. So what is the risk of clients coming in? Are you going to require them to be vaccinated? That's, I know, a big issue right now. Other things that you could provide is, assessments. I use PHQ-9 and the GAD-7. I have established safety plan that I have, or a sheet to fill out, a suicide assessments, ADHD assessments, all those kind of things that you can provide to just upgrade your service with the clients. Anything else with that, Zach?
I think that covers the majority of it. I think it's important, like sometimes, you might have documents that need updating, every year or every couple years, or there might be a document that you never update. I think it's just important to have a solid list of paperwork that, periodically you're looking to update, especially given how things have changed so much throughout COVID. Understanding, like, once you create the paperwork, it's probably smart to kind of like, look it over every now and then, just to make sure that you're keeping up with all the standards that are required these days.
Yeah. And just a little side note too, I recently signed up for this program called Psych Surveys, just because I do like to provide surveys in my practice. And it's just a HIPAA compliant software where you can provide, it offers a lot of different surveys, including the ones I listed right there. And even has diary cards. It's $5 a month. I don't get affiliated, any kind of affiliations for saying that I use them. I just, it's a nice way for you to provide it in a HIPAA compliant way right now. And it also allows you to schedule it for like every month, send out a depression screening. So just a side note there. Okay, business basics continued. Okay, so along with that, deciding on how you're going to be taking your notes and what's the structure for that. So there's a lot of different EHRs right now, health records, electronic health records that you could sign up for. And you could use paper, or I use just OneNote. How are you going to keep that all HIPAA compliant? If you use paper documents, or how are you going to lock those up? How are you going to take those? Are they going to be SOAP notes or GURP notes? A lot of things to kind of decide, especially if you're going to be billing insurance. What are the things that they're going to be looking for if they were to ask for your notes? Next, creating a vacation or transition plan. A lot of this stuff, say, clinicians don't really maybe think about right away, but you are going to take, hopefully, lots of vacations. And are you going to be available for your clients? If you're not available, who's going to be on your voicemail? Like, whose information is going to be on your voicemail and your email? So if your clients need someone during the time that you're away, who can they contact? Creating a professional will. So this is, say, if you were to pass away suddenly, how are your clients going to be told that you are no longer alive, and who is going to access your files? How are they going to access them? And how are they going to help transition your care? So who are the clinicians that you would like your clients to be transitioned to? And there's a lot in that too. I'm hoping to do a whole webinar on that, but these are all things to think about. Next, when your clients need a higher level of care. So if they are in danger of killing themselves, killing someone else, how are you going to find an inpatient, outpatient emergency psychiatric evaluation area for them if they need that, especially located in your area, what's available. If you suspect child abuse, elder abuse, or abuse of a vulnerable adult, researching the law on who you're supposed to contact and within what time line, and kind of what paperwork do you need to fill out for that. Having a plan for potential HIPAA breach. That's a scary one. We are trying our best to keep everything confidential with our practice, but when you hear about all these hacks all the time, what if Simple Practice gets hacked, and you are required to notify all your clients, and how to make that transition and talk to them about that. And then this last point, I think is really important to me. I hope it is to everybody else. How do you continue to work on being a multicultural counselor, or the best multicultural counselor you can be? So really questioning your own biases, really kind of looking deep, and doing interpersonal work to work on what kind of stereotypes and what judgments that you might have that you might be unconscious of. Also educating yourself and doing a lot of work around learning about different backgrounds, so that you can, again, work well with a diverse client group. Anything else? There's a lot there, Zach.
I think one thing that I would add around the section where what to do if your client needs a higher level of care, or if you need to follow through and make some type of abuse report. And I know for me, when I spent time both working in treatment and community mental health, there was a lot of kind of like standard operating procedures with a lot of those different types of things. So if someone needed a higher level of care, what were the steps needed to be taken? Or if you needed to report child abuse, what were the steps particularly needed? And very clearly written out. And that's something that I found helpful for me, even though I've done a lot of that stuff multiple times. I think it's important if you take the time to create like your own version or your own document of like, here are the steps that I need to take. It's very easy when we're in the heat of the moment trying to do different things in our practice. We might forget, oh, here are all the steps that I need to take in terms of helping a client get a higher level of care. So sometimes like even going through and creating your own documents around that could be helpful.
Mm-hmm. Yeah, you never know when a client might go through a crisis and might need a higher level of care. They could have never had suicidal thoughts before, and then something big happened in their life. You just don't know.
Right.
Also, with that note too, you reminded me. Say, a lot of people these days are getting multiple licenses, in different states. It's also knowing the laws in those states, and where is your client located in that state, and where is access to inpatient, outpatient services. So a lot to know with that. Moving on.
Yeah. So our next portion is kind of focused on interactions with clients. So I think the first thing is, how are you going to conduct and provide therapy? So it's important to determine and secure whether or not you're going to do telehealth or do it in office. And if you decide to do telehealth, you want to make sure that you find a HIPAA compliant software to use. Even though during the beginning of the pandemic, Health and Human Services, where it was lax when it came to some of the telehealth that was being done, I think it's just good general practice to make sure that you're continuing to do HIPAA compliant based telehealth work. Particularly if you ever apply for a telehealth certification, whether that's at a national level or depending on your state, you might be required to do a telehealth certification. You most certainly want to make sure that you use a telehealth HIPAA compliant software. And when you're thinking about doing office sessions, finding an office space to rent, this could also include like trying to find out like if your office space is going to be furnished. Is it going to be easy for you to rent the space, whether it's by the month, by the hour, by the day? There's a lot of logistics going into finding an office space to rent. So those are just a couple of things to consider. Location is key. So you want to make sure that if you do decide to do work in a physical office, that it's accessible to your potential clients, whether there are ADA requirements that need to be addressed in the office space, and making sure that, you know, if your office space has easy and accessible parking. Those are all things that go into selecting an office space. I think next we mentioned kind of HIPAA compliant software for telehealth. You also want to have a HIPAA compliant email system as well as a phone plan. Those are important because, again, that comes down to how are you regularly going to communicate with your client safely and securely. Something else that's pretty popular is doing kind of like the first impression kind of consultation calls with new clients. Some people might do 10 minutes, other people do 15 minutes. Some people decide to not charge anything for those consultation calls. Other people do charge. So it's part of those logistics of what you're going to do to create a plan, again, for your practice and how you're going to connect with those clients. With that, it's important to develop your own screening process, not only about, you know, screening the client, but also helping you to identify like the best clients that you want to work with. Because again, in private practice, you get to decide where you want to focus and the people that you want to serve. Developing screening processes, going back to some of that paperwork that Corinne was talking about, could also help screen for risk factors that might be important in the work that you're going to be doing.
Mm-hmm.
Anything that you can think of, Corinne, to add?
Yeah, along that same line, like risk factors, it's, you know, it's just me in private practice. It's not anybody else. I don't have a group practice. The clinic that I used to work at did have a 24-hour line that people could access. So, you know, it was easier to take on clients with a lot more risk. And kind of deciding where you feel comfortable on taking someone on that might have some more risk than or less risk than you did when you were in a community mental health setting. As Zach said, also, this gives us the opportunity to work with, potentially work with our clients that we work best with. And so deciding for yourself kind of who you work best with and maybe who you want to refer out and finding the right referrals. So I am not someone that regularly sees eating disorder clients just because I feel like that's a skill set I don't have. And so I may refer to Zach because he does have that background. And so really kind of figuring out who you would want to refer out and finding those right referrals for them.
Totally, those are all great points.
Mm-hmm.
All right, finances. For some, exciting, others daunting, and for most, somewhere in between. It's part of developing your practice is determining what your finances are going to be. So part of that is how much you're going to charge. There's a lot of different resources on the internet around, you know, what to charge in your area, what's appropriate, what seems to be low, what seems to be high. I think what's important is as you're developing kind of like your practice, looking at office spaces, technology, all that, you start to get an idea of like what a budget is. And once you start to kind of picture that, you'll then be able to kind of like then scale back, you know, what do I need to do to kind of meet the demands of this budget and surpass it? Because obviously you want to be able to make a profit in your business. This could include charging a full fee. This could have a range of having a sliding scale or maybe some slots that are lower fee to be able to address specific populations that might not be able to afford a higher fee. It's also an important time to maybe decide whether or not you want to join an insurance panel. Insurance panels can be real great resources for people that have insurance and are looking to access mental health services. There's benefits, there's cons, and you know, for some people that's the core position that they have in their private practices. So they are able to have a full practice just by using insurance or just by taking insurance.
Mhm.
If you decide to go that route, you need to apply for what they call a CAQH number, which is a tracking number that all the insurance companies will be able to kind of have access to and identify you as the person that's working through insurance. For some people, after you get the CAQH, if you don't necessarily want to be the one constantly interacting with insurance, having to bill the insurance, there's an opportunity to hire an insurance biller. This would be a third-party person that you can have involved with just handling billing insurance. For me personally, I use an insurance biller, and I think for me, it relieves a lot of the headache around billing insurance so that I can just focus around just doing the clinical work.
Mhm.
So after that, we're still talking about money. How are you going to bill and charge for sessions? Are you going to use credit card, cash, electronic services like PayPal, maybe use check? I don't think I have heard anyone lately in the last couple years use a cashier's check. But there's a lot of different ways that people can pay for therapy. If you do decide to go the credit card route, it's important to identify a credit card processor that you're going to go with. In recent weeks, there's been a lot of heat around Venmo and Zelle. It's important to note those are not HIPAA compliant payment processors. So even though there might be some reference of having some level of encryption, it's not HIPAA compliant. So it's important, if you do decide to take credit cards and you're working with clients, you want to have a HIPAA compliant credit card processor to manage that.
Mhm.
Anything else that you can think of, Corinne?
Oh, I mean, each one of these topics could probably be their own webinars. It's just so much
Totally.
information on here. Yeah, I mean, this is definitely a big one, I think, for therapists. We don't get this in our graduate program for sure. Really knowing your rate or your worth is always tied in for us, and offering, what we can survive on. First, being able to maybe offer some lower fees for people that can't afford the higher fees, and how do we do that ethically. Yeah, and just with insurance panels, there's pros and cons to that. That list can go on forever. But as you said, you could, I mean, it's easy marketing if you don't really want to market yourself. It's nice to get on panels, and your practice will fill up faster. When with credit card processing, I've jumped onto different things because they have different rates too, and they'll change. And that is a big fee for clinicians to have to deal with the rate of processing credit cards. So figuring out what's best for you.
Totally, and added to that, when in doubt, contact a CPA or an accountant.
Yes.
Accountants can be super helpful around that stuff. And if you need clarification, it's good to get that business support early on.
Mm-hmm. Yeah, so finances continued. Yeah, one thing that I decided to do, and I think that it helps me track my business finances, is open a business account. And so everything that a client pays me goes right through my business account. Anything that for expenses wise, I use my business a credit card. That way, at the end of the month, I can assign what kind of what deduction would that be on my taxes later. Is it an office supply? Is it marketing related? Just kind of hard to sometimes track all of those expenses, and you want to make sure you're getting all the deductions that you can. That's also something that you can create that ledger for your business, and then line it up with your kind of the revenue that comes through your account, just to make sure that everything is lining up. You may at that point also decide to do something like QuickBooks, or I use Wave. It's a free service, and so it imports my business credit card, and then from there I can assign it what it is for deduction wise, but you might do that through an Excel document or have your own process. Again, contacting a CPA, they can also help you with figuring out what kind of deductions that you have and how to track that. Finances, a big one is paying your quarterly taxes. And this is going to be to state and federal. You also may have some city taxes to pay at the end of the year, or county. So state and federal, these again refer you to a CPA because it will depend on your tax bracket and your deductions, and they can estimate your quarterly taxes. You will pay those 4 times a year or 3 times for state, for federal. And so they'll let you know kind of what time of year that you need to pay that and how you can submit that. So then the normal taxes that you'd have to pay during tax season, and anything that you might have mixed during those quarterly taxes, that will come up then on what you need to kind of pay or get reimbursed for paying too much. And again, we work in the LA city, and they also require us to do city taxes there. So look in your area to see if you have any other requirements. I also work in the city of Los Feliz, and I have a business assessment tax once a year that I have to pay. So I pay 4 different taxes to people. Another thing, just for finances wise, some people may need to look into a loan. There's a lot to set up here, your website, maybe hiring a lawyer, getting your paperwork established, maybe even rent. So that might be something that you look into, taking out a loan as an investment to starting up your practice. Anything else, Zach?
I would just add to that, looking into your local communities, whether it's local township, city, even small business bureau, to see if there's any seed money for startups. Because if you're starting a private practice, that's a new business that would be considered a startup. So there's often a lot of opportunity for private practitioners to get startup money. Just takes maybe a couple Google searches, maybe a couple different types of outreach to maybe find those different funding resources. But they can be very vital and essential if you're looking to find some startup funds.
Mm-hmm. Yeah, I think a good place to start with that is the Small Business Administration, which is nationwide. And they even have business, I think they call business counselors or some kind of business support through the SCORE network. So lots of options. All right, and then only a couple of points on this one, but just thinking about private practice mission, we've talked a little bit about that through the webinar so far. It's something that if you were building a business plan, it really would make you hone in on. But really figuring out, why are you here in private practice? Who do you want to serve? And that way, when you do have problems or issues that come up, then you can really revisit that mission and think, as I am coming from, this place of why I wanted to help and serve these people, how would I, keep to my ethos of my practice? Along the same line, it might include really getting specific on who you want to serve in like a niche area. And so, I like to work with people that are, say, going through their quarter life crisis, so people that are in their 20s and 30s, and you're really getting to know that client on, what they need to have, through their counseling, and getting trained accordingly. Say you want to do really more specific an eating disorder, maybe getting the eating disorder certification. So. Zach, anything else on that?
No, I think you covered it.
Yeah.
All right. So another area of, for some, excitement, others maybe some dauntingness, and a lot of in between. Marketing. So like we talked a little bit about creating a mission statement, a vision, business plan, a marketing plan is important. This is how you're going to reach out and try and find your potential clients. Are you going to look at online marketing, local networking, maybe going to workshops, online Facebook groups, or web listservs? There's all sorts of different areas that you can do marketing. What's important is just a couple things of note. Identify your focus, and if you decide to niche, like Corinne mentioned, this is a way for you to kind of specifically target and market to clients that are going to be looking for services in those areas. Once you do that, it'll be helpful for you to create an elevator pitch, whether this is to connect with potential clients, other therapists that might be good referral sources, or even connecting with other local providers that you never know might be great sources for referrals for you. In addition to that, it's important to track where your referrals are coming from. If you decide to go with a couple of web-based directories, they do cost money, and you got to put some money into that marketing. And depending on how much you spend, are you getting your return on investment? Are you getting, 1 or 2 clients per listing on a directory like Therapy Den or Psychology Today? Are you getting the return on investment, by being on a free listserv? It's really up to you. But with that also leads into kind of your brand. As part of the focus, you're also building out your brand and your story. That'll include your specialty, your niche. If you decide to share a little bit about your modalities and your background, really ultimately you're trying to create your pitch so that your customers can come and find you. Like we mentioned, referral sources from fellow therapists are vital. So it takes some time to kind of identify where those are coming from. But once you do, it's important to just kind of continue to acknowledge those referral sources so that they can keep them coming. In addition to kind of general marketing ideas, CalPIC has a lot of opportunities for therapists to kind of market themselves. We currently have regional-based listservs. We also have online Facebook groups. So there's a lot of opportunities for fellow LPCCs to market what they're doing. Anything that I missed, Corinne?
I mean, I think this is another slide that could be a whole webinar in itself. It could be like multiple webinars. There's so much information here. And as you said, there's just so many ways to market yourself. What I would say too is like choose a couple of them and get really good at it, because you can't do all of them, and I don't think that you'll be sincerely doing enough in each of it. You try to tackle all of the different ways that you can market. And then tracking again your return on investment based on that, like on your intake form, or even in my phone consultations, I'm asking clients how did they find me, so that I can note it down. Okay, they found me through Psychology Today or another referral from a therapist. So I know that networking has been working for me, or Psychology Today has been working for me. But there's things I just know I'm not going to do. I'm not going to do Instagram. I'm not going to do Facebook, or, I'm not big on doing any kind of advertising through Google. And so knowing what you don't think that you can do really sincerely to bring in clients, and also where your client's going to hang out, I think is really important. So in knowing your niche, and where, if my millennial client is going to be looking for a therapist, they're going to be looking online, and they're going to search term therapist in Los Feliz. And so I need to make sure that my SEO, my search engine optimization, comes up for that kind of listing. So I need to have those kind of search terms within my website. A whole lot to know about that, again, on its own. Okay.
All right, so continuing on the marketing train, we've come to printed materials. So if you're supporting yourself in a private practice, it's probably a good idea to have some physical piece of printed material that demonstrates who you are and what you're doing. This could include a business card, a brochure, a letterhead, maybe getting some professional headshots for an office, or if you're doing flyers for different groups. Sometimes it's nice to have a headshot on those printed materials. Mentioned a little bit earlier about where you're going to market yourself online. If you decide to use directories, there's a lot of different directories out there. There's Psychology Today, Good Therapy, Selling the Couch, Zen Care, Therapy Den, Therapy Tribe. There's a lot of different ways to market yourself on directories. Some cost money, some have little to no cost. So I think it's important to recognize, like, what are you looking for in an online directory if you do decide to pay for it. Next is creating a practice website. There's all sorts of ways to create websites on the internet. There's Squarespace, there's Wix, there's Weebly, there's Brighter Vision, Simple Practice, WordPress. And once you determine a website, it's important to get your domain name bought and paid for. This could be simply just the name of your practice. This could be the name of your practice plus, Zack Reed-Fier, LPCC.com. Like, it's important to get those domain names, because if people start looking for you and they put some of that stuff into their browser, that'll come up. So as we're starting to wrap up, we've got some just final ideas to add there to the startup of a private practice. I think it's important to take some time if you don't want to be doing therapy itself all the time in your private practice. It might be helpful to create a secondary or tertiary revenue stream. This could be coaching, blogging, speaking, doing social media. If you're renting an office space and they allow you to sublet, subletting a couple days a week might bring in some extra income. Also, determine if you want to have a business planner, advisor, or fiduciary. This is important. Again, we mentioned, getting different people to support you along the way, like a lawyer or an accountant. Being involved with a business planner can just make sure that you have the long-term trajectory that you're looking for. In addition to that, you could also join a mentorship community. CalPIC has a mentorship community, as well as peer-to-peer consultation groups, as well as Selling the Couch, Zini-Me, local mental health practitioner groups can be beneficial as well. Like we mentioned kind of throughout this presentation, if you feel like you need more business advice or guidance, seek out business professionals, maybe a CPA, maybe a business coach. Those can be very helpful in terms of helping you really making sure that you set up the right business. So just the last couple of things. You want to make sure that if you decide to do, maybe non-office-based forms of therapy, like walk and talk therapy, you get trained appropriately, as well as having corresponding paperwork that identifies all the risks as well as the benefits involved in it. As licensed professionals, it's recommended that we continue to get peer consultation and supervision when needed. CalPIC has peer consultation groups, so that could be a very easy, accessible resource for you as well. And I'll let the last one go to Corinne.
Yeah, this is my little soapbox, is go to your own therapy. This is a requirement of programs that you might be in, but I just think it's so important for us therapists to go to therapy. Just because, one, it's important to recognize or to know what it feels like to be in the other chair, just so we can really empathize with those clients and know what it feels like to help them through that process. Also, we don't come as a blank slate. We have backgrounds, we have things that are going to make us really good counselors because maybe we experience similar things to our clients. And so we really have to, process our own stuff so that we are not bringing that into the therapy room. It's not going to be triggered when we are talking to someone that has similar traumas. And so, I think I've also learned a lot about therapy through being in therapy myself, on what really resonated with me and how I can use that in my practice with my clients. So yeah, we are 1 minute to the end here. I know we had some chats with some questions. We may be able to answer one, but we did say at the beginning of the webinar that if you do have any questions and we don't get to it, info@calpec.org, then they'll be forwarded on to me and I'll be able to answer through email. But Zach, did you have the ability to get to that, the chat?
Let me see here. Nope, because as of right now, it's not showing up.
Okay, Analyte, do you want to either chat us the questions or take yourself off mute? Okay, she just said wrap up. Okay, yes, we're at the end here. Sorry, we weren't able to answer the questions. There was just so much to cover today. Again, please feel free to use the info@calpec.org, and we'll both take on answering those questions. But thank you so much for coming, and hopefully we'll see you around, maybe at a networking night or when we're actually in person at our next conference.
Thanks, everybody. Take care, and thanks for joining us today.